Leqembi is an FDA-approved medication that can slow the progression of Alzheimer's disease in patients who have mild congestive impairment or mild dementia and also have amyloid beta plaques in their brain. Leqembi is a monoclonal antibody that works by reducing these plaques, which helps to slow the progression of the disease. Who can use Leqembi? Leqembi received FDA approval under the accelerated approval pathway to treat Alzheimer's disease in patients who have mild congestive impairment or mild dementia stage of Alzheimer's disease and presence of amyloid beta pathology. How to use? You will have a Leqembi treatment in a healthcare setting. It will be given to you by a doctor or nurse. Leqembi is a solution liquid that is given through a needle placed in a vein, intravenous infusion in your arm. You usually have an infusion every 2 weeks, with each infusion lasting about 1 hour. If you miss an infusion, you should receive your next dose as soon as possible. This medicine may cause a severe reaction while having an infusion or shortly after the infusion. See side effects below for more information about infusion reactions. Your doctor may give you other medicines before receiving Leqembi to help prevent infusion-related reactions. Usual dose for Alzheimer's disease. The recommended dosage is 10 mg per kilogram that must be diluted and administered as an intravenous infusion over approximately 1 hour, once every 2 weeks. Contraindications. Before receiving Leqembi, tell a healthcare provider about all your medical conditions, including if you are pregnant or plan to become pregnant. It is not known if Leqembi will harm your unborn baby. Tell a healthcare provider if you become pregnant during treatment with Leqembi, are breastfeeding or plan to breastfeed. It is not known if lecanemab, the active ingredient in Leqembi, passes into your breast milk. Talk to a healthcare provider about the best way to feed your baby while receiving Leqembi. Tell a healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell a healthcare provider if you take medicines to reduce blood clots from forming, antithrombotic medicines, including aspirin. Ask your healthcare provider for a list of these medicines if you are not sure. Warnings. Tell a doctor and pharmacist what prescription and non-prescription medications, vitamins, nutritional supplements, and herbal products you are taking or plan to take. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. It is important to tell a healthcare provider if you take medicines to reduce blood clots from forming, antithrombotic medicines, including aspirin. Ask your healthcare provider for a list of these medicines if you are not sure. Leqembi side effects. Leqembi can cause serious side effects, infusion-related reactions. This medicine may cause a severe reaction while having an infusion or shortly after the infusion. You will monitor it by a doctor or nurse while you are receiving the infusion. If you experience any of these following symptoms, tell a doctor or nurse immediately: fever, chills, body aches, joint pain, nausea, vomiting, dizziness or lightheadedness, feeling or racing heart rate or chest pounding, difficulty breathing or shortness of breath. Your doctor may give you other medicines before receiving this medicine to help prevent infusion-related reactions. This may include allergy medicines, anti-inflammatory medicines, or steroids.